Hello, guys. So I'm going to talk about my assignment. And so the case that I'm considering for this Unit 3, Unit 6 assignment is Rameen. And that's the case of the Pakistani 27-year-old lady, woman, I should say. And she's a college going student whose father is a medical doctor. And she comes from a very constricted, strict, disciplined, very disciplined family where she's not allowed to pursue other interests other than her parents and other than what her parents say. She's currently a student of biology and wants to become a physical therapist. She does have problems with anxiety, depression, and she struggled with being who she is because her parents are highly controlling of her and don't allow her to do a lot of things that she wants to do in her life. So she's in therapy because she has anxiety and depression, and I can assure her. I mean, I'm not going to make promises, but I know things will get better once she sees a therapist. The first thing I would like to discuss with her, I would use the suicidal assessment because she currently is not suicide, but she has certain risk factors that will, you know, point her to that direction of suicide. She lives in fear, she hides from her parents, she doesn't tell her parents anything, and she's afraid to disclose her sexual orientation to her parents. She's gay, she's bisexual, she's not heterosexual, and in Islamic cultures, it's not really accepted according to what Rameen is saying. I'm pretty sure she may not know all of her religion, but I know that in some cultures, gay, bisexual, biracials are not accepted. So, I would like to do the suicidal assessment, risk assessment with her and gather information about why if she is planning on suicide or has she ever tried to take her life in the past. Now, she may not be suicidal now, but it's always safe to do it because you don't know some risk factors like her hiding from her parents and only telling her close friends can, maybe make her in the future commit suicide. She maybe she will in the future. Maybe she's at risk of it. Because she's depressed and people when people are depressed and have anxiety, they do commit things that normally normal healthy individuals would not do. So, some questions that I would like to ask her are all suicidal based questions. So, some questions that I would ask her are, some risk factors. What is she currently feeling? What kind of thoughts is she currently having? Is she looking to harm anybody? Is she looking to harm herself? And if she is looking to harm herself or somebody else, I will have to breach my confidentiality as a counselor. It is my foremost duty to report suicidal or abuse that is happening in the family or to my client. Um, she may have to go through a lot of inquiries. I may have to debrief her also in the suicidal assessment, but this is all for her own safety. So I will do a safety planning for her, gather information about her family, gather people to whom I should contact if she does go on with the suicidal plan. So things are serious, but in therapy, she will be able to become herself and be a better person. And that's the goal in therapy, to have your needs met and to be a better person at the end of it all. Some other assessments that I would ask her are just general assessment questions, like how is she feeling, how is her mood, what are the current problems that she's having, if she has any current problems that's going on currently. Just regular questions. And these are questions just to make sure that she's, doing healthy and she's feeling healthy enough to move on with her life. General questions. Um, in her situation, since she's not very suicidal, I would just have to ask clinical assessment questions, like when I'm doing the clinical interviewing part, gathering enough data from her, open ended questions, anything about her current symptoms. Are they affecting her daily life? How badly does her anxiety bother her? And gathering an interview question, assessment questions, basically just a biopsychosocial assessment of her and regular interviewing questions just to touch base, open ended, to make sure that she gives clear answers and just to reframe her mindset. Currently, Ramin is going through a hard time right now. She's hiding from her parents. She struggles from depression, sexuality problems, anxiety, and her mindset needs to change. We need to reframe all this so it brings it into a point of view, and we can deal with her problems better. I would actually encourage her to do a suicidal assessment with me because her suicidal is basically for her own safety. Because we see that she's struggling and she has, risk factors. Her family also maybe having mental health issues. So, performing a suicidal assessment, I will have to get an informed consent with her. She is 27, so she does not need her parents involved, but she's an adult, so I will ask her and I'll make sure that we are confidential and we're all following the ethical guidelines of a counselor. But I need her informed consent to to plan a suicidal assessment with her, just in case she does go a little bit out of control and she does decide to move on with the suicidal ideation. So this is all for her own safety, and I'm sure at the end of this assessment, we will be able to form goals and approximately reach those goals. So she'll be better in therapy, and just a few therapy sessions. Maybe she'll have to go for a year for therapy. I cannot predict how long her therapy will be, but she will be needing a few therapy sessions in order to improve her mental health status. Okay, so I would actually ask her permission to do a clinical assessment. In the therapy session, it's important for me and my client to build a therapeutic relationship. They may feel nervous, they may feel hesitant at first, but I have to assure that my client is feeling healthy enough to talk to me about their mental health status. And if they're not, then obviously we cannot, if they're too emotionally disturbed, then we cannot do therapy. But in her session, I will get permission from her and make her feel at ease. I'm also a South Asian lady, and I'm also from a similar culture like her, like Rameen's. I understand South Asian culture very well. I'm also South Asian, but I'm from the India side, and she's Pakistani, so our culture is not very different. But I could say some Indian people are much more liberal than she is, but we're not too far apart. So I can relate to her, and I can also help her and guide her into a better lifestyle than where she is right now. She has relationship problems. She has difficulty with her sexuality and she's not able to express her sexuality. So she can't have a girlfriend, she's not on a date, and that's restricting her. So she's 27 years old and she's past her teenage years. So she needs to be living a better lifestyle at the age of 27. Most people are married at 27 or in relationships or committed, but she doesn't have anything on her plate. She's only following what her parents want her to do. And that's driving her insane. She's hiding, she drinks, she's not allowed to drink, she's not allowed to be happy. So, that's something that we want her to feel in therapy. We want her to be a better person than what she actually is expressing. So I feel that therapy can help her. And by the end of our therapy sessions, I'm hoping that she moves on to telling her parents that she's confident enough to tell her parents about her sexual orientation. Her father is a medical doctor, so I'm sure that he will be understanding of her medical diagnosis. He's not too far from a therapist and a psychologist. So I'm pretty sure he would understand that her sexual orientation is gay and she should be accepted. What I don't understand as a therapist is that in some religions, sexual orientations are some are not accepted, like Jewish people, Christianity, and I know Islam may not accept LGBTQ, bisexuals, and transgenders than compared to other liberal religions. But it's a matter of biology and genetic predispositions and what we're born with. So, people should be accepted now in a time where people are starting to know and get to know about other cultures. People should be accepted for what they are. So, that's a challenge. And I'm hoping therapy can relieve her and make her feel better about herself. We just want Ramin to be a confident person because life in America is difficult. You have to be an individual and you're going to meet people every day with their own problems. And it's better that you solve your problems so that you can live a confident and happier lifestyle. The goal of therapy is to ensure that my client is healthy, happy, and living a healthy and productive life. And that's what we all therapists want for our patients and for our clients. Thank you.